Good morning and happy Wednesday to you, Ken. How are you?
I'm doing well. How are you today?
Good. I cannot complain. It's we hit a bit of a warm patch here from our ice storm on Monday, and we're anticipating another snowstorm on Friday. So,
Oh, yay. Yeah, I heard that a lot of people were out of power up there.
they still are. So
Oh, no.
It's going on a week. Luckily, I've had power, so I can't complain about that. But there are many people still without power in the cold, Michigan cold, for a week.
Not fun.
No, because there's so many other things that can be tied into it that you have to worry about, like your pipes bursting and whatnot. But
Sure.
hopefully we're just all waiting for Florida weather.
All right, we'll send some up to you. How's that?
We'll take it. Well,
Okay.
Thank you so much for taking the time and joining me on a Facebook Live.
Glad to be here.
So today we are talking about healthcare and retirement. What are your plans on today's discussion?
Well, we talk a lot about healthcare in retirement, and typically the conversation is around things like Medicare and Medicare supplements, and sometimes we'll also have conversations for those that have higher income. They talk about IRMA costs, or the income-related monthly adjustments additional costs that they pay, and sometimes we talk about Part D and Part B premiums and so on. But today, we really want to talk about the other kinds of aspects of healthcare and retirement. We're going to specifically talk about long-term care, ambulatory care, issues of dementia, that type of thing. And so, and the way I thought I would begin, really, it's a family conversation, typically for most. And I recently had a conversation with Bob. Bob's from Indianapolis. And so we were introduced. I got to come to know Bob because of a mutual friend, a client of mine. And so Bob's story, he's in his mid to late 60s, happy living in retirement, enjoying life and so on, financially secure. And we talked specifically about his family and specifically about his dad, who recently died. And so his dad lived a long life. His dad died at age 95 years.
Wow.
And his mom's still alive. She's 90.
Amazing.
And his wife's, he said, and my wife's parents are both still alive, and they're in their 90s. So he said, Ken, I'm one of those guys that's unique because I'm on the other end of the bell curve. I'm in my late 60s, and we've got parents who likely will live to 100 years old. And if you think about that for a moment, life expectancy has just exploded.
Oh, yeah.
Over the last 100 to 120 years or so. I mean, in the 1900, I think the life expectancy was like in their late 40s, early 50s. And now we're talking about people living into their hundreds. But we're into this conversation, and Bob's getting a bit emotional talking about his parents living older, and I thought, well, I've had 3 clients who made it to 100 years, so I really wanted to talk to him about that. And before I could even get into that conversation at all, he said, something that my dad said before he died, I think about, and that is, love means never having to say you're sorry. Now, I've heard that before, and it struck a chord for me as well. But I could tell that Bob was ready to have a conversation about healthcare in retirement, specifically about long-term care, and that conversation about taking care of those that make it to these kinds of ages and have the healthcare issues that are present as we get older. And specifically, though, the family dynamics of healthcare in retirement, and specifically talking about long-term care, the issues of dressing and eating and maintaining continence and dementia issues and so on. But here's the thing I think that's very relevant about this type of conversation. And that is that we never really get to the right solutions if we're having the right kinds of conversations. And so, and what I mean by that is that this conversation is not about how to get rich. Okay, it's not, look, Bob is in a position, and many people are in positions where they've got enough income in retirement. They're feeling pretty secure about things. They don't need to grow assets as much as to protect those assets. Mm-hmm. So it's really not a conversation about, how do I get richer, or how do we leave, lots of money behind to kids or grandkids or whatever our desires are. It's not really talking about lowering IRMA costs, and it's certainly not having the conversation about how to qualify for Medicaid, the government-sponsored program for those that don't have assets. It's really about those that do have assets and they just don't want to go broke.
Yeah, right.
It's about not being a burden to their family.
Mm-hmm. Yeah, no, it's long-term care is so important, especially nowadays because of the longevity. It's completely changed.
Yeah, absolutely. And one of the things, for 26 years now, I've talked to people about financial planning and retirement and help retire people and gone through all the phases of that. And you learn over time that this sometimes can be the opposite of bringing families together.
Right. Yes.
This can tear relationships apart. It can become burdensome. And that's where Bob was at, really, was the idea of, what do we do? How do we make this work? And Charles Lindbergh said it. And what he said is that it's strange that we talk the least about the things that we care about the most. Mm-hmm. Things like family and the future survival of our loved ones. And so this is the conversation to have, really, within the family, especially when we're in a position to be able to actually create strategies and to create scenarios that can offset this and keep families from having financial burdens and literally going broke. So I'll kind of give you a hypothetical to tee it up, and then we can go through what I think are the important points about this and what would encourage families to talk to each other about these kinds of issues. So, the typical retiree that I talk to is financially secure. They've saved, they've gotten to retirement. There's enough money there to take care of their needs. Yeah. If they want to travel, and that's in their future, they've got the financial aspects to be able to take care of that. So they're in a good place. But then here's this risk. Suddenly they could have some kind of an incident, a chronic illness, a physical disability that would require long-term care, either at home or assisted care facility or in a nursing home. And from that point forward, then the financial plan has to contribute more cash flow in order to offset those costs. Mm-hmm. And so again,
it can get pretty costly.
Absolutely. These kinds of costs are not like, paying more for utilities, or they're not the kinds of, we're talking about highly skilled individuals. Mm-hmm. And that's where that conversation about, well, Mom, don't worry about it, we'll take care of you.
Yep.
Or, we'll come together as a family and make that happen. We would love that to be the case. But here's the thing. Wouldn't it be more advantageous if you had the cash flow to pay for that professional person to come into the home or to be in a facility that would properly care for them? The question becomes how, and no one really has ever pushed back against that. The idea that they want to be there as a supervisor of this care, and they want to be there in heart and soul with their loved one, but to be able to make sure that the professional aspect of it is covered properly.
Yeah.
And we just call this the income gap.
Yeah.
This is what we're solving for here.
Yeah, no, absolutely. And I feel like when families are put in a situation where they have to come across this and they're financially and they're just planned accordingly, they're able to focus their main focus on what really matters and is your family and not everything around it when you have a professional taking care of everything else.
Absolutely.
And I really liked what you said earlier about people don't talk about what they love the most. That is so true.
Mm-hmm. Mm-hmm. Yeah, that's a great quote. It's spot on. And if we could just, emphasize that more, and it becomes a talking point when I'm talking to families. And we're talking about the strategy that's either in place and how it would be implemented, or here's how it would play out over time. And then we're able to go a layer deeper with it. We're able to get into the whole idea that you're there to make sure that the care is at the level that you really want. Because these things can happen it's very innocuous the way it happens. Diabetes can bring it on. A heart condition can bring it on. Alzheimer's is very prevalent. I read a stat that said 1/3 of Americans would be subject to some form of dementia and Alzheimer's. That is just amazing. Yeah, the probability is there, especially as we live longer. The real question is, how do you resolve this concern?
Yeah,
how do we close that gap? And so here are the things. There are a couple of aspects I think that are important. Typically in the financial plan, there are going to be assets that aren't being used for current income. If this need arises, then we can tap into those assets. Now, that may or may not be enough, and that's what we're solving for. Because you brought up the point a moment ago. When I first got into practice in the early 2000s, $2,000, $3,000 a month is what the care point was. Today, that number is $8,000 or $10,000 a month. I mean, It's just a gigantic leap. And so it's a very real question of, do we have the financial resources to be able to combat this? So it's additional cash flow, or in some cases, the family said, well, we could liquidate something. We could, sell something and make this happen. Now, here's the thing. This is not an asset challenge. It's a cash flow challenge. And here's why. It's not a single event. Okay, this is something that could be permeated over time. And if that's the case, then we've got to have income that will continue to match that need as time goes on. So it's really a cash flow question. And how do we solve for that? Now, here's how dramatic things are getting. And I can tell you this now because the state of Washington has mandated that there be long-term care policies in place for their residents. And if they are not in place, then they are going to force W-2 wage earners in the state of Washington to pay. And the current number is 58 cents per $100 of income. Goes into a fund that will help offset the Medicaid costs within that state. And here's the thing, is they're not the only ones. Okay, the state of Washington has a program that is to be initiated July 1st, 2023. So we're just months away from that being initiated.
They just announced it?
This has been in the works for a while, but it was just, they just passed it. Okay? This is a conversation that's been brewing out there for a period of time, but they're the first state to actually pass and implement that law such that on July 1st, those W-2 wage earners, now think about that, that's somebody who is working anywhere in the service industry or wherever in the state of Washington. They could be a 20-year-old, a 30-year-old, a 40-year-old, a 50-year-old. Their W-2 wages, if they don't have a policy, will go into a pool to help offset this. Now, here's the rub. in the state of Washington right now, the numbers have come out, and this 58 cents per 100 will contribute $36,000 towards the care of those individuals. Now, $36,000 is a drop in the bucket.
Yeah.
I mean, it's a partial year's worth of care. So those numbers already don't work. So we know that government will interject themselves into this equation at this point, at the state level at least, and begin to mandate some of this. So my point is that if the governments are going to do that, why don't we take a step back and create a strategy, a plan? Because if you have an existing strategy, if you have a plan, if you have a policy, then you can opt out of that.
Oh,
and that's what will be important, is to be able to have that choice so it's not mandated. Other states are doing the same thing. California, New York, Pennsylvania are right behind them in instituting the same kinds of program. So these things are happening out there at the state level. And so I wanted to again help folks understand that this is an ongoing conversation about how to take care of long-term care issues, not just a blip in time incident.
Yeah, that's it. I'm still like, how does a mandate take in place with situations like this?
Well, it's a desperate situation in my view. So what it means is that the funding is not there. Look, I mean, as a country, we've got a lot of debt. So as a country, we owe a lot. And there are a lot of social programs out there. And because of longevity risk, in other words, we're living so much longer, and because of high inflation that we're experiencing, you put these elements together, and these are really desperate attempts at being able to offset these kinds of costs. And everyone knows that healthcare is just one of those costs that continues to go up exponentially.
Right.
And here's the coaching that I use with it. I keep this at a high level because for most retirees, it generally gets down to two choices that they have with their money. Okay, there's only two things that they can do with their nest egg. One, they can spend it, right? What's the other one? Well, you're going to leave this earth and you're going to leave the money behind. Okay, now it can be done a whole lot of different ways. It can be left in trust for family. It can be lots of things can happen in there. But because we know that these costs are very likely to happen to a high percentage of retirees, then my point is that if you're not using the money for lifestyle expenses and so on, why not reposition some of those assets to help protect against going broke? Okay, to help protect against spending down all of your assets. And it creates a better family dynamic because now you've got the ability to deliver the care, and at the same time, you've got the ability to be able to protect the balance of those assets. And here's what I mean is that the industry itself, the insurance industry, has solutions for this. Let me go back to the point that I made a moment ago. I said earlier that you could either take it out of cash flow. Okay, it's a cash flow conversation. And so, or we could spend down an asset. We can just sell something. So what if we were to reposition, as an example, some of those assets? So let's just take a $200,000 example. Someone has a couple $100,000 in their IRA. Now, I know from experience, I have yet to have a client to spend every dollar they've got in their retirement plan. Okay, they die with money left in that plan. So the idea here is to either do it one of two ways: reposition $200,000 into a long-term care plan, or to take the cash flow that $200,000 would produce to create a pool of capital to offset the long-term care plan. And here's the way it would play out. Let's just say you did nothing, okay? Which there'll be some folks that'll say, well, I'm just not going to worry about it. Okay, so that person has a couple $100,000 sitting in the account. And let's just say that they were able to get 6 or 7 or 8% return on that money. So over the next 10 years, that might go from $200,000 to $400,000, we'll say. Okay, so they said, well, I'll just use my money to pay for it. So let's say that they avoided any losses and so on. 200 turned into 400,000. Now, if we take the cash flow out of that at the rate of say 6%, that would be what? About $2,000 a month, right? About $24,000 for the year. All right. So they could use that to pay for long-term care. Now, we already know that's not enough.
Yeah.
But if that were the plan, by doing nothing, then you're going to take the earnings off of that in the future. But here's what they don't know. If we could take that $200,000 and transfer it to the insurance company will actually, under contract, give them $4,900 a month long-term care benefits.
Wow.
Almost a doubling.
Yeah.
The amount of cash flow. And here's the thing, it's a lifetime benefit.
Mm-hmm.
Whereas when we're using our own money, we're going to use it until we run out of money.
Right.
We've transferred that risk to the insurance company. They're going to give us that cash flow for as long as we live. So the idea here is to talk to someone about strategy, because if we do nothing, we've got a strategy, which is to spend our own money, but we can actually lever it to a heck of a lot more moving forward. So that's the idea behind it. I'll give you another quick tip. Under the Secure Act, we can actually move that long-term care money out of an IRA and spread the tax bill out over a 10-year period.
Oh.
A huge benefit.
Yeah.
Versus someone who says, well, I got the money in the IRA, we'll just pull it out of there. Remember that $2,400 we were talking about a moment ago? You pull it out of there, you got to pay taxes on it. Right? Okay, well, I don't know what the taxes are going to be in the future, but let's just say it's 20%. Mm-hmm. Well, instead of $2,400, we're going to have maybe $2,000 net to be able to use for healthcare needs. Wouldn't it be nice to reposition, pay the taxes over a 10-year period, and then the $4,900 in this example would be all net usable cash for healthcare. All right, so a couple of things are going on there. There are a couple other strategies that I could talk about, but it's the idea of just understanding two things you can do with money. You're either going to spend it or you're going to leave it behind. If it's leave behind money, well, let's protect your assets so the family doesn't have to worry about what to do in the event that we start to have these long-term care expenses.
Yeah, it's just planning is so important for our future. And it's people like you that can help people like us and just say, we'll see what happens, because you're the professional here. And so people can just come to you, Ken, and just say, Ken, I need help. I need to reroute some stuff.
Well, the thing about it is, getting back to the statement that we were talking about before, is that you never get to the right solutions if you're having the wrong kinds of conversations.
Correct.
And the type of conversation to have is, how do I protect my assets against something that is highly probable to happen in our future? And it just keeps the family dynamics together. Mm-hmm. And it's really, if we think about it, it's assets that we really don't intend to spend, because we don't spend all of our assets. So now all of a sudden we've got a strategy in place, versus the idea of just having ourselves in a position to where we're, we're thinking, I'm going to go through time and see how it plays out.
Yep.
Well, go through time and create a strategy such that at each one of these intersections of probability, we've got a plan in place rather than being blindsided by it. And here's the thing, look, the government's going to step in and they're going to mandate something. Again, this example with the state of Washington is a prime example of a plan that won't work.
Yep. And it's going to happen quick.
It is happening. It's right before our eyes at this point.
Yeah, which is, mind-blowing. So call Ken.
Absolutely. Yeah.
Us.
Give a call here to our office and be happy to have that conversation and explain how these strategies work, provide information. Our number here, 321-454-3623. And I'd love to be able to open up that conversation and help educate people on what their options are while they still have the options.
Absolutely. Ken, any last words you want to chime in on?
Yeah, absolutely. Have these conversations with the family. Get some input. Get everybody on board with it. There's so many elements of just keeping the family dynamic together. And it starts with taking care of those that need the most care.
And it goes back to that quote you talked about earlier. It's a hard conversation to have, but you have to have it. And
it's a huge relief when they do.
Yes. But I had a conversation not too long ago with my dad, and you can tell he was uneasy about it. And it's not a topic you want to have, but you have to have it.
Yeah. And I think you'll find, Gina, as well, it's a tough conversation to have, especially when you don't know what your options are, when you don't have a sense about. Now, when you start to uncover what those options look like, then you start to realize, well, maybe we can have this conversation. And that's what we're here for, is to help people to just not go broke. They help them have choice as time goes on.
Yeah, great point. That was a very great point. Well, I appreciate you taking the time, as always, and hopping on. And like we always discussed earlier, Ken has podcasts as well. So if you were ever on the go and you want something to listen to, Ken's podcast, play to go.
Yeah, we try to put this information out there in the easiest way possible. In the end, we're happy to have that conversation and help you to understand what it is that we're doing here. And but I wish everyone well. Gina's been great spending time with you.
Absolutely. It's been amazing. And I've always enjoyed these Facebook Lives, and I wish you nothing but love and success.
Thank you so much. Well, back at you.
Yeah, thank you. And for everyone watching, please make sure to comment, like, and share this video. Thanks, everyone.
Bye-bye.